Hello and welcome to another video for Academic Coaching for World Changers. I am Coach Denise and I am going to help you pass that NCE today. So keep on watching and we're going to talk about one of the therapies, which is multimodal therapy. So that's what we are going to be talking about today. This was developed by Arnold Lazarus, and it combines multiple treatment modalities, which we will talk about a few of those, and it treats a variety of conditions like brain disorders, depression, anxiety, schizophrenia. So it can be used in a variety of different settings, different techniques can be used. So it can be seen as eclectic because it can take from different therapies, techniques, interventions, but it is its own called multimodal therapy. So, like I said, there are 7 modalities. It's a holistic approach because it looks at the whole person within those 7 modalities. And how the client presents is how they are treated. But I will talk about that in just a second. So the result is that the client sees that it impacts all areas. So even though they present in one area and they're treated in that area, it might also present in a different way and it's treated differently for when it comes up like that. So those 7 modalities you can remember with the acronym BASIC ID. So that stands for behaviors, effective responses, sensations, images, cognitions, interpersonal relationships, and drugs. So behaviors, those are things like that you do. So your actions, your habits, things like that. Your affect or affective responses, those are your emotions, your feelings. And then sensations, so think about your 5 senses. Images, that might be memories, dreams. Cognitions, those are your thoughts, ideas. Interpersonal relationships, so your interactions with people. And then drugs might be biology, your genes, things like that. So, for example, if depression is presenting in B, behaviors, then that might look like staying in bed, isolating, things like that. So the therapist will use techniques such as developing behavioral goals or scheduling various activities such as plans with loved ones. Next, if the depression is presenting in cognition, then the client may have self-critical thinking. So see how it's the same thing, but it's presenting in 2 different areas. So the therapist might challenge their thoughts and help them change their thinking patterns. So depending on how the client presents is how they are treated based on those 7 modalities in BASIC ID. So some techniques that can be used. First, you want to make sure that you match the client with what they come in with. So you use a technique based on how they're presenting, kind of like how I just showed in those different examples on the slide before. So you can do some anxiety management, and that might look like deep breathing, meditation, relaxation, positive imagery, anything like that. Maybe modeling. So that would demonstrate the behavior to be acquired by a client. So as the therapist, you would demonstrate that behavior so that the client can see it being done. Other techniques are assertiveness, biofeedback, hypnosis, thought stopping. So there can be a wide range of techniques that are used within this since it is a holistic approach. So let's try it out now. But if you don't get it, then go back, watch the beginning of this video again. because you want to make sure that you understand that basic ID, those 7 modalities, and how it can show up for a person. But let's try it out. So in multimodal therapy, the A in the 7 areas of functioning acronym basic ID is for A, age, B, affect, C, attitudes, or D, activities. So take a minute, pause this, think about it. B, affect. So remember that affect, that is someone's feelings, things like that. Let's try one more. In multimodal therapy, if the client is presenting with low motivation and isolation, what is a technique that could be used? A, thought stopping, B, meditation, C, hypnosis, or D, reinforcement. So think about what is going on for the client, how they're presenting, and then remember what Dr. Pam says. It's a reading test. So they're presenting with low motivation and isolation. Which one of the 7 modalities would that fall into? And then think about 2 answers that you could eliminate because you know they don't have anything to do with how they're presenting. And then think about it, go back to the question, see which one is the better answer. D, reinforcement. And that's because how they're presenting is based on behavior. So you want to use a behavioral technique, and that would be reinforcement. So make sure that you subscribe to our channel, check out our website, academiccoachingforworldchangers.com, which is right below. And if you want to book some sessions, you can go to our website or you can book with me. If you liked this video, then you can email me at coachdeniseacwc@gmail.com. But if you want to learn more about multimodal therapy or other therapies, check out other videos or book a session to make sure that you pass that NCE. And remember, it's a reading test.